I'm doing this video because I had a partial knee replacement several years ago. In the next few minutes, I'll cover answers to questions you may have if you expect to have a partial knee replacement operation soon. How long will I be in the hospital? Your age, general health, and physical condition play a role here, but you'll probably be discharged 1 to 3 days after your surgery. I was discharged about 40 hours the day after my operation. Your doctor will want to know that you can stand, move about with the assistance of a walker or cane, and flex and extend your knee sufficiently. How long will I need assistance walking? It could be as long as 2 to 3 weeks, but it could be less. I was actually getting around without a cane or a walker in about a week. When can I take a shower or bath? In most cases, you can shower as soon as you get home, provided you cover your incision with some kind of waterproofing. I used a plastic grocery bag large enough to cover the knee, secured with medical adhesive tape. You'll need to keep doing this until your incision heals, possibly about 10 to 15 days. Your doctor will probably advise you not to soak in a tub or swim, even with the knee covered, for 3 to 4 weeks. What about ice packs to keep down swelling? You should put an ice pack on your knee several times a day for about 20 to 30 minutes each time for 2 to 3 weeks. Also apply ice after physical therapy exercises for as long as necessary. Elevating your leg with pillows helps reduce swelling too. How about physical therapy? Physical therapy exercises generally start right away. You'll need to work with hospital staff or a qualified trainer in a well-equipped rehabilitation center. You'll probably need to go several times a week for up to 3 months. When can I start driving again? It depends on how well your rehabilitation therapy goes, but also which leg had the operation. If the surgery took place on your right knee, you'll probably need 2 to 6 weeks before it's safe to get behind the wheel. If the left knee underwent surgery, you won't need that long. And you shouldn't drive as long as you're taking prescription pain relievers that may limit your awareness or reduce your reaction time. How long before I can return to work? Once again, the answer to this question depends on a number of variables: your general health, physical demands of your job, and how you travel to work. For jobs that allow you to sit most of the time, expect to return in 2 to 6 weeks. But if your job requires a lot of walking, standing, or kneeling, or is physically demanding, like construction, it may be up to 3 months. How about recreational exercise and sports? Talk to your surgeon. Some exercises and sports activities are tougher on your knees than others, especially those that require twisting, turning, running, or jumping. When can I travel normally? Your doctor will probably advise against a long driving vacation or an extended airplane flight because of the danger of developing blood clots. Clots are more common after surgery, and they can actually be life-threatening. Your doctor may prescribe a blood thinner before your trip or may tell you to postpone your plans for several months. And don't be too concerned about setting off metal detectors when you go through airport-style security. It may happen, but it's rare. You might want to alert screeners as you're going through. My doctor gave me a small card to show screeners just in case, but no one has ever asked me to see it. What are the long-term effects? Expect to regain full strength and motion, or close to it, in 6 to 12 months. But even after that, kneeling and stooping may make you a bit uneasy indefinitely. Some patients notice occasional discomfort, stiffness, puffiness, or perhaps less range of motion for years. How long will my replacement components last? The answer to this question depends on your age and the demands you put on your knee. The non-organic components in your knee are extremely durable and will probably never wear out enough to need replacing. What about my scar? Yes, you'll have a scar, but after 6 to 12 months, it will be a pale, thin line, only about 6 inches long. That covers most of the questions you're likely to have about recovering from a partial knee replacement procedure. To view videos on related topics, please click on the links below.